welcome to Fathers Who Care, and Happy New Year to you good people out there. As always, it's been, I like to use an old saying. I don't know what's going to come over me, but you know I'm getting older. So every now and then I have the tendency to go back to some of them old Soul Train days.
Okay.
So every now and then I get on the show and I say, you know, it's been a stone blast, honey.
All right.
Remember Don Cornelius?
I do remember this.
And so every now and then I get a chance to just talk about that and get that in the show. And so anyway, I just want to thank you all again for tuning in to Fathers Who Care. And as always, you know, it's just our desire to bring to you individuals and information that has been vetted in our community. And we want to share with you real people who are making a difference in the neighborhood, and what can we do to continue to do the work in the neighborhood. And of course, you know, I'm going to introduce to some and present to others my dear sister and friend. I think she's one of the hardest working sisters on this west side of Chicago. And not only that, you know, my show is kind of funny over here at Fathers Who Care, and I'm teaching them young people over there, Amari and Estrada and Marshayla and all of the other ones who are involved and may not be here tonight, the importance of being true to your call. And so I really thank God for the opportunity to have real good people around me. And as we have our dear sister here, we're going to introduce her in a minute. I just want you all who will be watching to know that we are really committed to trying to empower the least of us in our community. And we believe that we can do that through all of us working together for the common good of empowering each other. Everybody understand that we all are vested and that we all have our own interests and our own ups and our downs. But if we just continue to pool our resources and continue to work together, there's nothing we can't do. I am just so disappointed in the fact that how easily our people can be duped, and how easy they'll sell out for just the minute of things, all right, when we got so much to live for. And our babies are going astray, our babies are disenfranchised, they're disheartened, they are lack of hope. We're trying to bring hope back in our community. We're trying to let our young people know that you can be anything you want to be, but our young people can't be what they can't see. So if our young people don't see what they need to see in their homes, in their parents, in their community, then what you expect from them. So you're coming live with Fathers Who Care tonight, and we're talking specifically with our dear sister and friend, none other than Queen's sister, Tamala Milan. All right. Of course, I'm going to give you a brief intro on who she is and what she do in 1 second, but I just want to let you all that's watching the show know that this is a show that we want to specifically talk about the state of health care and the state of health care and mental health in the African American community, all right? Some folks be running around here, Tamala, talking about they got mental health issues, or they have, I hear so many young people talk to me talking about they got anger management issues. Where you get that from, all right?
This is true.
So we want to talk about that tonight, and we want to talk about what can we do to save our babies and save our communities. But most of all, I want all of you all to know that we love you, we forgive you, and we support you. So now you don't have to worry about all of that baggage no more. Let it go. We got my queen who I see on the line here, Gloria Elaine. I see so many folks tuning in to you already. So listen, you're watching Fathers Who Care. Our guest this evening is none other than my dear sister, Tamala Milan Alexander, and she's a mother, grandmother, a healthcare professional, community activist. She's a professional up under the program of Maternal and Child Healthcare Partnership and Outreach Network. Tamala has more than 20+ years of experience in the maternal and child healthcare field. She's now working as a peer educator, a facilitator, a case manager, just to name a few. Tamala is always on a mission to empower the least of us. She's always building capacity, bringing about holistic development, addressing social issues through education, through healthcare, through civic environment. She's currently serves on the board of the Ever Thrive. She's vice president of the Health Connect One board of directors, the AAP Family Partnership Network executive, and I'm very, 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 very proud to say that she's an executive member of the West Side Community Stakeholders Leadership and Development Committee that we are actively working on together.
Absolutely.
I mean this in all, in the most serious of conversation, Tam, that I really believe that your heart, that whatever the Lord has allowed you to go through in your life, He allowed you to go through that in your life to be an example for so many others. I see that in the work that you do. I see what brings you joy. And you know, you can look at people and see if they really feel what they do, or if they just faking it just to get through. And that ain't you. That ain't you. I mean, you really no. That's fact. That's real. That's real talk. That's why I asked the question tonight when we was in there chopping it up. I say, so Tam, well, tell me what's your purpose? Do you know your purpose? And you went right at it. I said, yeah, she know. she know what it is. So listen, you're watching Fathers Who Care tonight. Good to see you, Bruce. That's Phil over there. Love you, my good brother Phil Jackson, and others over at Black Star. But listen, we really want to talk about the state of health care in the state of Illinois. And how can we address some of the mental health issues and other concerns affecting our babies? And most of all, what happened to Prince?
He died.
What happened to Prince?
He died.
Yeah, he did.
Unfortunately.
He gone. I think it was fentanyl or something like that. Yeah, and it's an opium, right?
Opioid.
Opioid. So we want to talk about opioid. What is opioid, and what is Lil Wayne doing with the opioid? Is he actually using it? And you're going to educate us, because you told me something today with our young people when we had some conversation. You was talking to and you enlighten our young people, and they would say, yes, yes, yes. So with that being said, look, thank you again for tuning in to Fathers Who Care. For the next few minutes, we're going to be talking about, as I alluded to, the state of health care in the state of Illinois, as well as we're going to talk about mental health, the state of mental health with our young people and our community. Are you really crazy, or are you bipolar? You know, they hear that stuff every day. And if you hear something long enough, you start believing it.
You can.
You know?
You can.
So we want to let you know, don't let folks kind of dupe you into being something that you're not. And parents, stop telling your babies and your children that they're crazy and that they got issues, and stop calling them certain things if you don't want them to become what you call them. Is that fair?
That's very fair.
So let's have the show. You're watching Fathers Who Care. The number here is 312-738-1060. The phone lines are now open. And we're talking about mental health. We're talking about how can we address our mental health. Should we address our mental health? Are you mentally healthy? And what do you feel about going to get an assessment if you feel like you've been overwhelmed?
Absolutely.
I get like that sometimes. I get overwhelmed. And we want to talk about health care and the state of health care. Okay, is that fair?
That's very fair.
So again, Tamala, first of all, thank you, and I want to thank you, my dear brother and your husband, for coming out with you tonight. Thank you so much, and we want to ask you a few questions, if we don't mind, just to kind of have some fun.
Sure.
So, but Tamala, I know what you do professionally, and I kind of read some of that stuff, right?
Yes.
And you do your work. That's your job, right?
That is my job.
But who is Tamala though? What moves Tamala? You know, we talked about your purpose, and do you know your purpose, and are you living your purpose? And so I guess I want to know, sometimes I work like a Hebrew slave, literally, all right? Literally. And sometimes my downtime is just my worship. You know, when I get my worship on, when I'm in church. But then I'm still working. All right.
Well,
because I'm teaching and I'm preaching, so I'm working.
Yeah.
But when I relax, sometimes the way I relax is I have to take a long ride, or I have to, I like to sit around. I like to be in the wilderness. I like the water. I like to sit on the water and watch the waves and things like that. But who is Tamala?
Well, I am a mother of 6. Mm-hmm. I have 5 adult daughters and an adult son, and married my husband about 3 years ago, Ernest Alexander, and for the life of me, I don't know why he committed to all this dysfunction that we had, but he is with us, and just an amazing man, and has been really my rock through a lot of situations. I do have young adults, but I think what I enjoy most now, at the end of the day, when I debrief, I walk into a new role when I go home at night with my grandchildren. My grandchildren are just sunshine. Sunshine. I have one that I call Marmalade, affectionately, and Marmalade meets me at the door. She meets me at the door, and she's quick to shuffle my shoes off so that she knows that I'm staying there for the rest of the evening. I mean, it's just a joy.
You lit up.
Yeah, it's just that's my Marmalade. She's about to be 4 years old, but it's just awesome.
So a
to
proud
see it.
mama and proud grandmama.
Very proud grandma.
Yeah.
Very proud.
So
Grandma.
that's your passion. That's your purpose. That's your soul. That's your energy.
It is.
Your lifeline. Well, let's go to, if I may, if I like to go in and ask you a question. Now you do a lot of work with what they call the MCH partnership, and I believe that's the Maternal and Child
Health
Initiative, right?
Correct.
What is that? You know, what is that?
Well, one of the things, maternal and child health is just our way of saying moms and babies.
Okay.
We're trying to ensure that moms and babies have an opportunity to have a healthy start, to have a fighting chance.
Which is important to get them while they're young.
Well, it's important to get them before they're even started,
before
they're even exist. We do a lot of work with preparing mothers or mothers to be or young women before they go out and have children. We want to make sure that they have the necessary skills and the ability to have these children. So we try to go out there and educate them. Often when they get to us, they may already present themselves as being pregnant. So now we have to get them their first time, or they're suffering with either addiction issues or social ills that are occurring within their life. They might be going through domestic violence. They don't have anywhere to stay.
So you do a holistic approach.
We have to do a holistic approach with our families. And so our maternal and child health programs are geared towards that, specifically our high-risk program, Westside Healthy Start.
So now you say Westside Healthy Start. What is that? I mean, just because I like to know what.
Sure.
Westside Healthy Start. That's where you work.
This is where I work.
Okay.
I'm a Westside. First of all, I'm from the community as well.
Okay.
But Westside Healthy Start is a infant mortality initiative.
Okay.
Many people don't know that African American babies, specifically in Austin, East and West Garfield Park, and North Lawndale.
Can I show some of this information about it?
Yes.
Okay, go ahead.
And so we have these huge disparities between babies who are born on the west side and others. Okay. Babies who are on the west side of Chicago, especially neighborhoods that are economically depressed like Austin, East and West Garfield Park, and North Lawndale.
Okay.
We try to reduce the infant mortality rates because our babies die at 3 times the rate of our white counterparts. I always feel like one baby dying is too many, but the fact that we have such alarming rates on the west side in particular, we have to address that issue, and one way we do that is by providing them with Healthy Start services, which is housed inside our Access Community Health Network centers.
Well, and I noticed that you're watching Fathers Who Care, and of course what we're talking about tonight is, of course, we're talking about health care, we're talking about mental health, we're talking about the state of health care in Illinois, and then we want to go into talking about opium use, right?
Yeah.
And what is it, and are young people doing it, and what can we do to kind of help our young people to understand and try to refrain from getting caught up in Robitussin and all of this other little stuff, and leaning and all of that other stuff, lean, to drink lean.
Yeah.
You know, I'm trying to have a little fun with it, but I'm serious about it. But I want to thank all of those who are on Facebook, Lance, Dorian, Brother Dorian, and all the other ones that I may have missed. Keep on tuning in. Call in with some questions on what the state of healthcare, what can we do to empower our young folks. Sound like we got a caller. Can we hit that caller?
Yes.
And then when we come back, we want you to talk to us about what is the state of healthcare and what was the mandate that was in that tax bill. All right, that I was told it was snuck up in that federal tax bill that would impact us here.
All right.
Anyway, come on, caller, you on there? What's your comment and question, please?
Yes, how you doing, Mr. Jones?
I'm doing it. I'm living my life. I'm living a purpose. I'm on the field doing His will and trying to make a deal, and it's your turn.
I wanna just say thank you and the young lady for all your hard work. This is Rhonda Lanier's mother, and I remember you played a big part in Rhonda's life when she was young, going through having a baby. I just thank God for people like you that work so hard and strive so hard to help the people in the community and outside the community. And I just hope God continue to bless you and the young lady. And thank you so very much. And just please keep up the good work. Thank you guys so much.
Thank you so much for tuning in. It's been a...
need this.
Thank you.
You still there? Thank you
Yes.
Thank you so much for calling in. It's been a minute since I heard from you, but it's always been my pleasure. I'm still doing the same thing I was doing when I was doing it with your daughter, but it wouldn't hurt my heart that much if you would tell your daughter to give me a call. You know, tell her to give me a call and let me know how she's doing, and tell her I'd like for her to come on over and talk to some of the young ladies that we have in the program now who can benefit greatly from her. And it wouldn't hurt if she would come on back every now and then and be a success story on one of our young people's TV shows that they're doing these days, and talk about what's going on in her life and how her life has changed because of intervention and support. But thank you for the support you've been giving your daughter. Thank you for tuning in tonight. Again, we're talking about healthcare, the state of healthcare in Illinois, and what can we do to remain mentally sound, and is it okay to seek out mental health intervention? But anyway, back to our guest this evening. I introduced to some and present to others is none other than my dear sister Tamala Milan, and she's also from the Westside Healthy Start Initiative, i.e. Access Healthcare Network.
Access Community Health Network.
There you go. You know, I know you knew.
Yeah.
But anyway, but you was going to tell me, what do you think is the state of health care in Illinois? Slide over just a little bit because I want to get us in that shot together. But go ahead. What is the state of health care in the state of Illinois?
In particular, I think what I can most talk to is the fact that we have, low-income areas, especially on the west side, where we have these underserved African-American and Hispanic women and families who are not being served to the degree they need to be served. And that's why it's so important programs like yourself align themselves with organizations like Access Community Health
Which
Network.
is a not-for-profit organization.
Which is a non-for-profit.
Okay.
And so just aligning ourselves with different community organizations so that we can get the word out about the services, because one of the things that we pride ourselves at Access for doing, and as being an partnership and outreach worker, I get an opportunity to tell people how to come in and get the services that they need.
Right.
As you always state with us, education is power. You can't do better if you don't know better.
Yeah.
So it's really about becoming knowledgeable about the services that are there for you. And Access is really great in that aspect, because we usually serve the underserved and the underinsured.
Right.
And we have a policy of having families come in. I mean, we're one of the biggest purveyors of community health centers in the country.
Okay.
And so we have over 36 health centers that are available and easily accessible in most of our Chicago neighborhoods.
And you're not-for-profit.
And we're not-for-profit.
Go figure. Thank you.
Yeah.
So let me ask you this question. So if you had to say that the state of health care for the state of Illinois, if we had to give it a grade, A, B, C, or D, a good, excellent, good, fair, or poor, what would you say?
You know what? I've been doing this for about 20 years.
Plus.
And I'm going to go with, I think we're at a C+.
A C+. So that would be like poor.
It's not good. It's not great,
good.
but it's not as bad as it used to be.
Okay.
Just because I've had an opportunity over these past couple of decades just to see the awesome work that organizations like yourself, us over at
Partnership
Access,
works,
and just
collaborating
and making sure that those who are the most vulnerable
Right.
in our communities
Right.
have an opportunity to be served. And that's what makes
Well, and you know that's what I do. That's what you do. So it ain't
Absolutely.
hard to do what you do when you do what you do.
Absolutely.
But I want to thank you for your honesty and your genuineness on where we are in the state and where we are in relationship to health care, because health care should be a right. All right, everyone should have the right and the opportunity to get affordable, effective health care. It should not be a challenge for folks to want to be healthy or have the resources to be healthy.
Absolutely.
But in the way things are going, it's like folks have to compromise if they're going to pay for their deductible, or if they're going to go get them this, all right? Or if folks are going to pay for health care, or if they're going to get this. And I think that's kind of ludicrous to say the least. But here's the thought, though. Why is it such a challenge for folks to understand the importance of being healthy?
Well, I think some of those challenges is just that sometimes we're not educated enough about what can B, what we can receive and what services are out there. That's why we think it's our best job, it's our work, it's our passion to go out there and let them know that places like Access exists. Healthy Start exists for pregnant mothers who need that extra
The MI
support.
program for fathers.
Male involvement program.
Yeah.
We want people to know that we're here.
Right.
We have these services. They're within our walls. We come outside those walls as
Right.
well, so that we can get the knowledge out there.
Okay.
Knowledge is always power.
I agree.
And more knowledge they know about where they can receive the
I agree.
services,
The more power.
the powerful they are.
Now, you have. I know you got access in Ashland, Austin, Blue Island, Booker, Brandon, Madison.
Just to name a few.
Just to name a few.
But those are where our medically assisted treatment programs are.
Oh, okay. And so what we want to do tonight, we want to talk about the state of healthcare, and we want to ask you a question. Is it okay to seek out medical intervention? And let me ask this question while we're going there. What is your mental health status?
My mental health status today is healthy.
Healthy.
Healthy. One of the things is really important is to know how to decompress. I just told you when I get home
And I mean
at
like
night,
exhale.
it's an
unwind.
exhale moment.
Yeah.
But
Woosah.
we work with over 800 women, and we talk to some of the toughest. I mean, we deal with some of the toughest situations that
Judy.
you can think of that happens within families. Somebody may be going through depression. Someone may have lost a loved one. You know, there's a lot of violence on the west side of Chicago and grief counseling. And so we have an opportunity to touch so many different people's lives. You also have to be mindful of keeping yourself healthy as well.
So I guess I'll just jump on out there and tell you, listen, I'm striving every day for that. I'm a real spiritual person, and I rely on my faith. But I need to balance that out a little bit more. And so what I was alluding to earlier, when I was talking about some of the things that kind of literally relaxes me, because I'm a real wired up, kind of tense dude.
No kidding.
You know, I go from 10 to 100 real quick.
I have observed it.
I get there real quick, you know.
But it's passion.
Yeah, it is passionate.
It's just passion.
Yeah, it's all good. It's all good. But if you don't want to know, don't come around me messing around, because you'll get it real quick. But listen, and so I was really, thank you for allowing me the opportunity to talk specifically about mental health, because I think it's really important that we address mental health and we let folks know that it's okay to be healthy. Now, with that mental health being the issue that we was talking about, why is folks kind of resorting to external relief or using medication and other illegal substances or legal substances to find their release when they might be mentally disturbed or depressed or going through some challenges? I don't want to give no labels because, you know.
Absolutely.
But you understand where I'm going with that.
I do understand.
Right.
And most of your viewers probably understand it as well.
Right.
It's just to be numb.
To be numb.
To be numb. My experience has been to be numb.
So folks want to be numb.
They want to be numb. It's
Wow.
a lot to, you know what, as someone who was born and raised on the west side of Chicago, we have so many challenges. Lack of adequate education sometimes and necessary services. And even though I work for a great organization, there is a lot of work that still needs to be done. And we are striving really, really hard by putting medically assisted treatment programs like we have that not only aligns them with getting the treatment that they need for their addiction, because now they've chosen to be numb.
Right.
You have to get them to understand that being numb is not living, but living is dealing with those issues. And so we have a three-prong effect. We have our medically assisted treatment programs, along with having someone from our behavioral health team to help them assess and get them back on the right track.
Right. And you know, we do a lot of health fairs together
All
the time.
All the time.
And I think one of our main reasons or impetus for trying to do this stuff is to make sure that folks are healthy and that they have opportunities to get affordable and accessible health care. Is that fair?
Absolutely.
So we was talking specifically about opium. What is that?
Opioids.
Opioids, yes.
You know.
Opioids, right?
Well, of course, it's a depressive drug,
Okay.
and so I always tell people based on my own experience as someone who went through that in life, and back in the day, as they refer to it. I think right now, once you fall in any addictive pattern, that could be not just opioids, but alcohol or anything. Whenever you fall into an addictive state, the best thing and the only thing that really matters is someone grabbing you by your hand and telling you where to go. That's why I think outreach work is such an important part of the work that we do.
But what is an opioid?
Opioid.
Specifically, is that what Prince died from?
He did.
Did he? What was that?
That's in the family of opioids. I don't have the clinical definition of what an opioid is, but
Fentanyl.
that is what they determined him to have passed away from.
Like Robitussin.
It's, you know, a lot of things that we have in
Codeine.
Codeine, like Tylenol with codeine,
Right.
could be considered an opioid.
Vicodin.
Pain relief. People have
There
back
you go.
pain. They've been in an accident.
Right.
Now they've chosen to use these. It's supposed to be a pain reliever.
Initially.
Now they're addicted.
Initially, right?
Initially.
Like Michael Jackson.
Like Michael Jackson.
Yeah.
Become addicted to these pain relievers. Right. And instead of, you know, using it for a limited amount
Like
of time.
Blue on the Temptations on TV.
Oh, don't talk about Blue. Talk about Blue.
But you know, I'm really trying to make
Yeah.
it personal.
But
I'm trying to make it personal.
I bet
right?
we want people to understand that something as simple as because your leg was broken, now you know you're taking this treatment, you're in pain.
Yeah.
Anything can lead you to that point.
On that addiction.
Well, we want to push, especially with our access centers, and
Right.
and as you showed before, where some of our locations are.
Mm-hmm.
The biggest thing that we want to push is that help is available.
Right.
Help is out there, and if you really want help, we have some great places
Tell us
for
about
you
it.
to come. We have access, especially on our west side. We have Access Madison, which is right on Madison and Hamlin. We have Access West Side, right off 3752 West 16th Street. We have Access Humboldt Park, which is right off 3202 West North Avenue.
Okay.
And you have now a list of our locations. We have Access Austin.
So if
right
they
off
wanted to get in
Cicero.
touch with you, how could they do that?
Well, we have, like I said, we have over 36 health centers.
What's your
and,
website?
AccessCommunityHealthNetwork.net.
.net.
And we have a lot, I mean, we touch every neighborhood.
Yeah.
And I think that's what's so awesome about Access and its services and the treatment that we have in some of those different communities. We offer a patient-centered medical home model. So we try to treat all of our patients, all of the participants in our different
Well,
initiatives.
I'm going to say
like
this
that.
here in all honesty. I've been working with you guys for some time now.
Yeah.
And I really mean what I'm saying, that you guys have been extremely actively involved in so many endeavors to empower folks on the west side of Chicago. And I mean, I know you and I are always in each other's company every time we look up
Yeah.
because we are laboring out there to try to empower so many others. And we want you all to know, thank you some folk, I guess they was playing with the phone in there, but we can't get the call right now unless we got a quick caller. Go ahead. Caller, you on the air quickly.
My question to the young lady is, so do you think if you get in a situation where you have to take pain pills, do you think it's a good thing to take the pain pills, or should you get a lesser dosage so that you don't get so addictive to it? And then also, what do you think about the fact that they are trying to bring prescription marijuana to our state?
Legalized
and how do you
marijuana.
think that
Well,
will
it's actually legalized already in Illinois. But go
Yeah,
ahead.
it's already legalized.
Marijuana is legalized in Illinois already.
I can't speak much to prescription marijuana, but what I can say is whenever you're in a situation where you need to take something as strong as a pain reliever or medicine in the opioid family, I would always say be very, very careful and always seek out your medical provider's advice.
Right. And it shouldn't be that long.
And that's
shouldn't
one
be
of
on
the
there that
biggest
long.
things. If it's
Yeah.
long-term use, you
Yeah.
might want to make sure that you seek out a provider with that. You asked me about how can they reach Access. We have a toll-free number. It's 1-866-267-2353, or reach out to us at accesscommunityhealthnetwork.net.
God bless you. Good night. We'll see you next week. It's been a Stone Guys, baby. Thank all of you all on Facebook. Thank you all for tuning in. God bless you. Good night. Keep the faith. Adios, my friends.
Thank you.
Good night.